Okay, I will also be performing how to do an intradermal injection using a TB skin test. So before entering my patient's room, I confirm with the doctor that there's an order. After entering patient's room, I perform my 9 rites and confirm name and date of birth. I will tell my patient what I'm doing. I'm going to give you a TB skin test in your forearm. I'll go ahead and clean off my vial. I'm going to get about 0.1 of the solution. Okay, I'll go ahead and pull back. Insert my air. Then retract. There we go. Okay. I would also clean off the area. My thumb right here. Kind of pull back on my patient's skin a little bit. Go bevel up. There we go, and there should be a little bleb. Okay, I would apply a little dry gauze on the injection site to kind of dry them off, not dry them off, but clean off any blood. And then I would explain to the patient not to put any lotion, like fragrant lotion or soaps for the next couple of days. Get a subcutaneous injection as well. So it looks like the doctor has ordered 10 cc's of insulin for my exact same patient from the last video. I would still confirm name and date of birth and my 9 rites, but I would get my 100 units insulin needle, clean off my insulin cap. And then take out 10 cc's. Alrighty, I would clean off my patient's skin, grab about an inch, and I'm gonna go at a 45-degree angle. Okay, there we go. Would clean off the area. Before leaving the room, I would again practice bed safety and make sure my patient is okay. Hi, my name is McKensi and I'll be performing an intramuscular injection today. Before entering the room, I would check my doctor's order and confirm that this patient is receiving a 1 milliliter dose of sodium chloride. So after entering the room, I would introduce myself to the patient. I would verify name and patient's name and date of birth, and then verify my 9 rites. After that, I would explain my procedure, saying I'm going to give you a 1 milliliter injection to your deltoid. Do you have a preference on which arm? We'll go right arm. Okay, perfect. So I'll clean off the top of my vial. We'll take my 3 milliliter syringe. Go ahead and apply my blunt needle. Okay. We'll draw back 1 milliliter in my vial or my syringe. Okay. And then draw back 1 milliliter of solution. There we go. Go ahead and recap this. And then I will switch it out for my, I believe this is a, let's see, 20 gauge. Oh my goodness. It came out. It's okay. Mine does not do that, my little orange one. Okay, so normally that would not happen, but you would apply it here. It's fighting me. You would apply it, you would clean off the area on the patient. You would take, this just does not want to stay on there. 3 fingers right there, squeeze, remove the cap, go at a 90-degree angle, and then push it in. There we go. Hold it in for a couple of seconds. It'll come out. There we go. And I would get my little swab in case they're bleeding, cover it, and dispose of everything in the sharps container. After leaving the room, or before leaving the room, I would make sure all my safety checks, so bed alarms, bed in lowest position, rails up ×4, brake set, and call light and reach. Show you how to do an IV push and IV piggyback as well. So first of all, I would confirm with my doctor that we've ordered an antibiotic. I would go into the patient's room, confirm my 9 rights, and also name and date of birth. I would explain what I was going to do, so I'm going to go ahead and give him an antibiotic. So what I'll do first is clean off my, well, I would stop this if he is receiving meds. So I would stop, clamp it off. I would clean off my J-loop. I would flush for a minute. Okay. Make sure that I'm getting drawback as well, and that it's not burning or hurting the patient in any way. After that, I would clean off my antibiotic. Apply my blunt needle. Okay. Pull back. We'll do about 1 milliliter. Well, it's probably not going to let me. No. But if my blunt needle was working correctly, I would draw back 1 milliliter. Would recap, take this off, and then I would push the IV antibiotic into my J-loop for a minute. Then after that, I would take it off, grab my IV flush, and I would push that for a minute as well. After that, I would recap my needle, recap my J-loop, and if I were doing like an IV piggyback as well, I would make sure that if my IV bag was like lower, the piggyback one, and that it would be right here versus here, if that makes sense, because we don't want it to go as fast as this is going. Before leaving the patient's room, I would ensure bed safety, and yeah.